Let me ask you something. When you get out of bed in the morning, is the first thing you feel pain? Stiff knees, aching hips, fingers that won't cooperate until you've been up for an hour? And even then, there's this exhaustion underneath everything, like your body is running on fumes no matter how much sleep you got. If any of that sounds familiar, I want you to know you are not alone. I hear this from patients every single week, and more importantly, you are not stuck. Because here's what most people over 60 don't realize. A huge part of that daily pain, that fatigue, that brain fog, it has one root cause, and that cause is chronic inflammation. Not the inflammation you get when you cut your finger and it heals in a week. Something quieter. Something that's been building in your body for years, and that your diet is either feeding every single day or fighting. In this video, I'm going to give you the 7 foods I recommend to my patients over 60 who want to push back against that inflammation. Not supplements, not expensive treatments, real food. Food you can find at Walmart, at Costco, at your local grocery store that has genuine, measurable, science-backed power to reduce your pain and get your energy back. Stay with me through the whole video because I'm also going to show you a simple daily plan, and I'm going to tell you the mistakes that cancel out all the benefits, even when you're eating the right things. My name is Dr. Leonid Kim, and this is Senior Health Review, where every video is designed for one purpose, giving you practical, trustworthy health information to help you feel better in the years ahead. Let's get into it. Before we get to the foods, I want to take just 2 minutes to explain what's actually happening in your body. Because once you understand this, everything else makes much more sense. Most of us grew up thinking inflammation is a bad thing, and it can be. But acute inflammation, the short-term kind, is actually your immune system doing its job. You sprain your ankle, it swells up, it heals. That's normal, that's healthy. Chronic inflammation is different. Chronic inflammation is when your immune system gets stuck in on mode. It's low level, it's constant, and it doesn't have a specific injury to heal. Instead, it quietly damages your tissues, your joints, your blood vessels over months and years. And you feel it as pain, stiffness, fatigue, and that general sense that your body just isn't working the way it used to. Now, here's what changes after 60. Researchers have actually given this a name, inflammaging. It's the combination of the words inflammation and aging. As we get older, several things happen at once. Our hormone levels shift. Our gut microbiome, the community of beneficial bacteria in our digestive tract, starts to decline. Our cellular repair systems slow down. The result is that our bodies tend to run at a higher baseline level of inflammation, even without any specific injury or illness. This is why joint pain that was manageable at 50 can feel overwhelming at 65. It's why recovery takes longer. It's why fatigue becomes a daily companion rather than an occasional inconvenience. The good news? Diet is one of the most powerful levers we have to address inflammaging. Specific foods contain compounds that directly interrupt inflammatory pathways in the body. They're not magic, but they are real, and they work. So with that context in mind, let's talk about the 7 foods. Number 1 on my list, and honestly, if I could only recommend one food in this entire video, this might be it, is fatty fish. I'm talking about salmon, sardines, and mackerel specifically. Here's why they're so powerful. Fatty fish are the richest dietary source of omega-3 fatty acids, specifically 2 types called EPA and DHA. These 2 compounds have been studied extensively for their anti-inflammatory effects, and the research is remarkably consistent. EPA and DHA directly reduce the production of inflammatory molecules in the body, including prostaglandins and cytokines, which are basically the chemical messengers your immune system uses to trigger inflammation. For people over 60, the joint benefits are particularly significant. Omega-3s help maintain the viscosity of synovial fluid. That's the fluid that lubricates your joints. Less inflammation, better lubrication. That means less morning stiffness and less pain when you move. But the benefits don't stop at your joints. EPA and DHA are also critical for heart health, brain health, and reducing the risk of the kind of systemic inflammation that underlies so many chronic diseases. How much do you need? Aim for at least 2 servings of fatty fish per week. If you can do 3, even better. A serving is roughly 4 to 6 ounces. Budget note. I know fresh wild-caught salmon can be expensive. Here's something I tell all my patients. Canned sardines and canned salmon are equally effective. The omega-3 content is essentially the same, and you can get a week's worth for just a few dollars. Don't let cost be a barrier here. How to prepare it. Baked, broiled, or steamed. Avoid deep frying. The high heat and inflammatory seed oils used for frying will work directly against the anti-inflammatory benefits you're trying to get. Food number 2 might surprise you. Tart cherries. Not sweet cherries, tart cherries specifically. The Montmorency variety, which you'll usually find as frozen cherries, dried cherries, or tart cherry juice. Tart cherries are one of the most concentrated natural sources of anthocyanins, a type of antioxidant that gives them their deep red color and has potent anti-inflammatory properties. Several clinical studies have shown that tart cherry consumption can significantly reduce markers of inflammation in the blood, including C-reactive protein, which is one of the key markers physicians use to assess systemic inflammation. Here's why this matters, especially after 60. First, tart cherries have shown meaningful results in studies on gout, the condition caused by uric acid crystal buildup in the joints, which becomes increasingly common with age. Research published in the journal Arthritis and Rheumatology found that participants who consumed tart cherries had significantly fewer gout attacks than those who didn't. Second, and this is something I find really compelling, tart cherries are one of the few natural food sources of melatonin. For my older patients who struggle with sleep quality, this is a bonus that's hard to ignore. Poor sleep drives inflammation. Anything that helps you sleep more deeply is, indirectly, helping reduce your joint pain. I had a patient, a 67-year-old retired teacher named Margaret, who came to me 3 years ago almost unable to walk without a cane because of gout flares and knee pain. We made several dietary changes together, but she was most surprised by the tart cherries. She started having 8 ounces of tart cherry juice every evening before bed. Within 6 weeks, she told me the gout flares had dropped by more than half. She was sleeping better too. How to use them. 8 ounces of unsweetened tart cherry juice daily, or a half cup of frozen tart cherries in a smoothie or over oatmeal. If you buy the juice, check the label. It should be 100% tart cherry juice with no added sugar. Number 3. Extra virgin olive oil, or as I'll call it from here on, EVOO. This is a food that the Mediterranean populations have used for thousands of years, and modern science has given us a very good explanation for why it works so well. The key compound in EVOO is called oleocanthal, and here's something remarkable about it. Oleocanthal works through the same biological mechanism as ibuprofen, non-steroidal anti-inflammatory drugs, or NSAIDs. It inhibits the same enzymes. The difference is that oleocanthal works more gently, without the gastrointestinal side effects that ibuprofen can cause, which is very important for older adults whose digestive systems are more sensitive. About 3.5 tablespoons of high-quality EVOO contains roughly the equivalent anti-inflammatory effect of a low-dose ibuprofen. I'm not saying EVOO replaces medication. Please don't hear that. But as a daily dietary tool to keep background inflammation lower, the evidence is genuinely compelling. EVOO also contains a compound called oleic acid, which helps reduce levels of CRP, that inflammatory marker I mentioned earlier, and supports healthy blood vessels and heart function. The catch: quality matters enormously here. Many bottles labeled olive oil or even extra virgin olive oil on American grocery shelves are actually diluted with cheaper seed oils like sunflower or canola oil. These seed oils are high in omega-6 fatty acids, which are pro-inflammatory, the exact opposite of what you want. Here's how to find the real thing. Look for California Olive Ranch, Kirkland Signature Organic EVOO at Costco, or any bottle with a harvest date on the label within the last year. Real EVOO should have a slightly peppery, almost spicy finish when you taste it. That's the oleocanthal. If it tastes flat and neutral, it's likely diluted. How to use it: drizzle over salads, cooked vegetables, or fish after cooking. Don't cook with it at very high heat. Use it as a finishing oil to preserve the oleocanthal. Food number 4 is one of the most talked about anti-inflammatory agents in both traditional medicine and modern research: turmeric. The active compound in turmeric is curcumin, and it has been studied in hundreds of clinical trials for its effects on inflammation, joint pain, and a range of chronic conditions. The results are consistently positive. Curcumin suppresses multiple inflammatory pathways simultaneously. It's one of the broadest spectrum natural anti-inflammatory compounds we know of. For arthritis specifically, a 2016 systematic review in the Journal of Medicinal Food found that curcumin supplementation produced meaningful reductions in joint pain and stiffness, comparable in some cases to low-dose NSAIDs, without the side effects. But here's the critical thing most people get wrong. Curcumin, on its own, is very poorly absorbed by the human digestive tract. Your body sees most of it and passes it right through. This is why you can eat turmeric every day and not get the full benefit, unless you add one specific thing: black pepper. Black pepper contains a compound called piperine. When curcumin and piperine are consumed together, the bioavailability, meaning how much your body can actually absorb and use, increases by up to 2,000%. That is not a typo. 2,000%. So the rule is simple. Always use turmeric with black pepper. Always. If you take a turmeric supplement, make sure it contains black pepper extract, also listed as bioperine on labels. How to use it: add half a teaspoon of turmeric and a pinch of black pepper to scrambled eggs in the morning. Stir it into soups or stews. Make a golden milk, warm unsweetened almond milk with turmeric, black pepper, a little ginger, and a small amount of honey. It becomes a daily habit very quickly. Number 5. Dark leafy greens, specifically spinach, kale, and Swiss chard. I know, you've been hearing eat your greens your whole life, but let me explain what makes these particularly important after 60, because it goes beyond general nutrition. Leafy greens are rich in vitamin K, specifically vitamin K1, which plays a critical role in bone health. After 60, bone density loss accelerates, and the connection between inflammation and bone loss is bidirectional. Inflammation contributes to bone breakdown, and bone breakdown can increase inflammatory signals. Vitamin K helps interrupt that cycle. They're also one of the best dietary sources of magnesium, a mineral that roughly 70% of Americans over 60 are deficient in, according to national nutrition surveys. Magnesium is a natural muscle relaxant. It helps reduce muscle cramps and tension. It supports sleep quality, and it plays a direct role in regulating the body's inflammatory response. Beyond that, leafy greens contain vitamin E, folate, and a range of antioxidant compounds, including quercetin and camphorol, both of which have documented anti-inflammatory effects. I remember a patient, a 71-year-old retired firefighter named James, who came in complaining of severe leg cramps at night and persistent lower back stiffness. His blood work showed low magnesium. I had him add 2 large handfuls of spinach to his diet every day, in a morning smoothie mostly, because he wasn't much of a salad person. Within 3 weeks, the nighttime cramps were almost gone. The back stiffness improved significantly within 2 months. How to eat them? 2 packed cups per day is the goal. Options: a morning green smoothie, a large side salad with EVOO, sautéed spinach with garlic as a dinner side, or Swiss chard added to soups and stews. Cooked or raw, both provide excellent benefits. Number 6. Blueberries. Pound for pound, blueberries may be the most antioxidant-dense food you can put in your body. They are loaded with flavonoids, particularly a compound called pterostilbene, which is similar to resveratrol but more bioavailable, as well as anthocyanins, which we discussed with tart cherries. But here's the angle that I want to emphasize specifically for my patients over 60, the brain benefits. Chronic inflammation doesn't just affect your joints and your energy, it affects your cognitive function. Research from Tufts University found that adults over 60 who consumed blueberries regularly showed measurable improvements in memory, processing speed, and attention compared to a control group. The researchers believe this is directly linked to blueberries' ability to reduce neuroinflammation, inflammation in the brain. For the fatigue piece, which I know is a major concern for so many of you, blueberries help by improving mitochondrial function. Mitochondria are the energy-producing structures inside your cells. As we age, mitochondrial efficiency declines, which is a major driver of fatigue. The antioxidant compounds in blueberries help protect mitochondria from oxidative damage and keep them functioning more effectively. Fresh versus frozen. Frozen blueberries are just as effective as fresh, and often cheaper. The freezing process does not meaningfully degrade the antioxidant content. Buy a large bag, keep it in the freezer, and pull out a cup every day. How to eat them. A cup a day is ideal. Over oatmeal, in a smoothie, mixed into plain Greek yogurt, or simply eaten by the handful. This is one of the easiest foods on this list to add to your routine. And our final food, number 7, is walnuts. Walnuts are unique among tree nuts because they are the only one with a significant amount of ALA, alpha-linolenic acid, a plant-based omega-3 fatty acid. While ALA is not as potent as the EPA and DHA you get from fish, it still contributes to the body's anti-inflammatory balance and is a meaningful addition to a diet that already includes fatty fish. But the omega-3s are just the beginning. Walnuts also contain elagitannins, which gut bacteria convert into compounds called urolithins, and these urolithins have been shown to have significant anti-inflammatory and anti-aging effects at the cellular level. Interestingly, this conversion only works well in people with a healthy gut microbiome, which is one more reason to focus on gut health as you age. There's also a stress component worth mentioning. Walnuts are one of the richest dietary sources of polyphenols that help modulate the body's cortisol response. Chronic elevated cortisol, the stress hormone, is itself a driver of inflammation. Managing stress chemically through diet is something we don't talk about enough. How many? About a small handful, roughly 14 walnut halves or 1 ounce, is the daily target. More than that, and you're getting a lot of extra calories. How to use them? Keep a small container of walnuts on your kitchen counter and eat a handful as a mid-morning or afternoon snack. Add them chopped to oatmeal, yogurt, or salads. Easy, no preparation required. Alright, now I need to talk about something just as important as what to eat: the mistakes that undo everything. Because I've seen this happen too many times. A patient starts eating salmon and blueberries and feels pretty good about themselves, and then wonders why they aren't seeing results. And when we dig deeper, it's almost always one of these issues. Mistake number 1. Cooking your anti-inflammatory foods in the wrong oils. This is the big one. If you're baking salmon in a pan coated with vegetable oil or canola oil, you're partially canceling out the omega-3 benefit. These refined seed oils are extremely high in omega-6 fatty acids, which are pro-inflammatory. Use olive oil, or simply bake on parchment paper without added oil. Mistake number 2. Buying fake olive oil. I mentioned this already, but it bears repeating. If your EVOO tastes like nothing, it's probably not real EVOO. Check labels. Look for a harvest date. Brands like California Olive Ranch and Kirkland Organic are reliable. Mistake number 3. Using turmeric without black pepper. We covered this. Without black pepper, you're absorbing a fraction of the curcumin. This is non-negotiable. Mistake number 4. Relying entirely on supplements instead of whole foods. Turmeric capsules, fish oil pills, blueberry extracts, these can have a role. But whole foods contain fiber, cofactors, and synergistic compounds that isolated supplements simply don't replicate. Use food first, supplements second. And perhaps the most important mistake of all, mistake number 5, eating anti-inflammatory foods while continuing to eat large amounts of pro-inflammatory food. You can't out-eat a bad diet with 7 superfoods. The biggest inflammatory drivers in the American diet are refined sugar, white flour, ultra-processed snack foods, and fast food. If those are daily staples, the benefits of your salmon and blueberries are going to be severely blunted. You don't have to be perfect, but if you're serious about reducing pain and fatigue, you need to be honest about the other side of the equation. I know what some of you are thinking. Dr. Kim, this sounds like a lot of changes. I hear you, and I want to be very clear. You don't have to overhaul your entire diet overnight. That approach almost never works. What works is building habits 1 or 2 at a time. Here's a simple framework to start with this week. Morning. Wake up and have a cup of plain Greek yogurt or oatmeal topped with a handful of frozen blueberries and a small handful of walnuts. If you want to go further, add half a teaspoon of turmeric and a pinch of black pepper to your eggs. Lunch. A large salad built around 2 packed cups of spinach or mixed greens. Dress it with 2 tablespoons of high-quality extra virgin olive oil and a squeeze of lemon. Add whatever protein you like. Dinner. 2 to 3 times a week, make your protein salmon or sardines. Season with turmeric, black pepper, garlic, and a little lemon. Bake at 375 degrees for 15 to 18 minutes. Serve with a sautéed leafy green on the side. Evening snack. 8 ounces of unsweetened tart cherry juice about 30 to 60 minutes before bed. That's it. That hits all 7 foods. The total cost at a place like Walmart or Costco for a week's worth of these specific items is typically under $40. Start with just 2 or 3 of these changes this week. Add more the following week. Within 3 to 4 weeks of consistency, most of my patients begin to notice a real difference in morning stiffness and energy levels. Give your body time. It responds. Let me leave you with this. The medical system, for all of its tremendous advances, tends to treat inflammation after it's already caused damage, with medications that manage symptoms. And those medications have their place, absolutely. But you have a tool that you can use every single day, 3 times a day, that can reduce inflammation before it causes that damage. That tool is your fork. Your body at 65, at 70, at 75, it is still capable of healing. It is still responding to the signals you send it. Food is information. Every meal is a message to your immune system, your joints, your mitochondria. The question is, what do you want that message to say? The 7 foods we covered today are 1. Fatty fish, 2. Tart cherries, 3. Extra virgin olive oil, 4. Turmeric with black pepper, 5. Leafy greens, 6. Blueberries, 7. Walnuts. Print that list out, put it on your refrigerator, take it to the grocery store this week, and give it 30 days. If you found this video helpful, please give it a thumbs up. It genuinely helps this channel reach more people who need this information. And if you haven't subscribed yet, please do, and hit that bell notification so you don't miss what's coming next week. Because next week, I'm going to cover the 5 worst breakfast habits that make inflammation 10 times worse after 60. And I promise you, number 3 is something that the majority of Americans over 60 are doing every single morning without realizing the damage it's doing. You will not want to miss that one. This is Dr. Leonid Kim with Senior Health Review. Take care of yourselves, and I'll see you next week.